560 The Answer.
Now, from the Signature Bank Studios. Only the biggest stories, only the biggest guests, and only the biggest opinions. This is AM 560, The Answer.
Top of the morning, Dan and Amy. Well, one thing that the Democrat Socialist senators did during the RFK Jr. hearing is help RFK Jr. I mean, most of these senators are just so bad at asking questions. And it's somewhat jarring because many of them are attorneys. Yeah. Maggie Hassan, wasn't she the Attorney General of New Hampshire before she was a senator? Do I have that right? Regardless of whether she was or she wasn't, she can't shut up long enough to get an answer out of RFK Jr. as she's trying to play gotcha. And then she doesn't even listen when he does try to provide a response so that she can then intercede. Cortez Masto, Nevada, who should have been defeated, she did the same thing.
You keep citing the Trump administration and you're just going to follow what they say. Is that what you're doing? You're just a rubber stamp for them in this position? So anybody, so it doesn't matter that you're before us. It could be anybody coming before us as long as they're a rubber stamp for this administration and disregarding your beliefs and what you think. I guess my question to you is, if it really is fundamental to what you believe, how do you live with that? How do you address those issues as you're moving forward, knowing that it's going to harm Americans? Yeah.
You want me to answer the question?
No, I want to ask it another way.
Okay. President Trump has asked me to end the chronic disease epidemic and make America healthy again. And I'm
so is that the only reason why you're at HHS? Is that the only reason why then you're at the HHS, to address that one issue?
President Trump has asked me because I'm in a unique position to end that. And that is what I'm doing. And if we don't solve that problem, Senator, all of the other disputes we have about who's paying, and whether it's insurance companies, whether it's providers, whether it's HMOs, whether it's patients or families, all of those are moving deck chairs around on the Titanic. Our ship is sinking. Our 60% increase in Medicaid over the past 4 years is the biggest budget line now, and it's growing faster than any other. And no other nation in the world has what we have here. No other nation has a chronic disease. We have the highest chronic disease burden of any country in the world. We had, during COVID, we had 16% of the COVID deaths in a country. We only have 4.2% of the world's population. We had a higher death count than any country in the world. And when CDC was asked why, they said it's because Americans are the sickest people on earth. The average person who died from COVID, American, had 3.8 chronic diseases. This is an existential threat economically, to our military, to our health, to our sense of well-being. And it is a priority for President Trump. And that's why he asked me to run the agency. And if I'm privileged to be confirmed, that's exactly what I'll do.
Cortez Masto has a law degree from Gonzaga, and yet her response to "I'm here to end chronic disease" is that the only reason you're here? Well, that's a pretty big one.
Yeah,
that's a big undertaking. Maggie Hassan, I mentioned her law. I don't think she's AG; she was just governor, but she's got a law degree from Northeastern. Yeah. So these barristers that embarrass themselves.
Sometimes science is wrong. We make progress. We build on the work, and we become more successful. And when you continue to sow doubt about settled science, it makes it impossible for us to move forward. So that's what the problem is here. It's the relitigating and rehashing and continuing to sow doubt so we can't move forward. And it freezes us in place.
I mean, that is like COVIDian 101, this idea that science is settled, as we have talked about ad nauseum from the pandemic forward, actually even pre-pandemic, talking in the context of climate change. The science is never settled. That's the point of science. scientific method, testing and retesting. Somebody comes up with a new theory. Is it replicable? Or a new result? Is it replicable? I mean, we always want people asking questions. We always want people challenging. Maggie Hassan wants to end debate on particular topics, and RFK Jr. doesn't. And anybody who wants to live in a free society and get to real truths and real answers shouldn't either. Real tell by Maggie Hassan there. For more on this, please be joined by Dr. Martin Kulldorf, former professor of medicine at Harvard University and Mass General Brigham and a founding fellow of the Academy for Science and Freedom. Professor Kulldorf, thanks for joining us again. Appreciate it.
Yeah, good morning.
So how do you think RFK Jr. fared amid the sparring with senators?
Well, I think he had many good answers to somewhat stupid questions.
Yeah. Well, and I mean, you heard my riff, but just the whole, I mean, it continues. They refuse to relinquish that talking point that on whatever they disagree with RFK Jr. about, the science is settled and you're not allowed to ask questions, like you heard from that New Hampshire senator.
Well, I think there are three main things that RFK Jr. is trying to do here. One is the one that was mentioned, is to the chronic disease epidemic, and that's a huge problem we have in the U.S. And there's a lot of things to that. It's obesity, it's asthma, allergy, autism, and so on. That's going to be a huge challenge, but it's some challenge we have to take on. The other two things that are very important that RFK is stressing is we have to go back to evidence-based medicine. That's what's thrown out of the window during the pandemic. And we have to do randomized trials, which is emphasizing. We have to do good observational studies. But we have to get back to evidence-based medicine. And then the third thing is conflict of interest. That is corrupting our scientific community. We have to avoid conflict of interest and have open scientific discourse. Otherwise, we cannot make progress with science.
On the issue of conflict of interest, then, would you agree? I mean, it's a difficult thing to do, but Elizabeth Warren raised the issue. The issue of RFK Jr. continuing to receive compensation from this trial firm, this plaintiff's attorney firm that he is with, as they're suing pharma companies often over vaccine injuries. I mean, the idea that he can financially benefit as HHS Secretary with the policy-making influence he has as HHS Secretary in that sector seems to be, me, sort of a conflict of interest on its face.
Well, I don't think the DHS Secretary have any influence over the courts and shouldn't have any influence over the courts. But I don't know the details about that case or about the situation.
Well, what about what Senator Wyden raised, again, playing devil's advocate here? RFK Jr. is presenting himself. He is not sort of ideologically anti-vax. It's just exactly what you described. That's how he's describing it. Wants evidence-based vaccines and scientific research into vaccines. Fine. But he's also said previously, and he mentioned I had my children are vaccinated, but he's also said if I could go back and do it over again, I wouldn't have got my children vaccinated. So, there is some evolution of statements on particular topics like vaccines coming from RFK Jr., and I wonder if those give you any pause for concern.
Well, I'm a big fan of vaccines, and I think vaccines is one of the major public health successes that we've had. I think that if we want to restore vaccine confidence, which we have to do, and it has plummeted because of the unscientific dealing with the COVID vaccine mandates, but if we want to restore vaccine confidence, then we have to have somebody like RFK Jr. and let them do the vaccine safety studies that they want. And,
well, what about pushing certain values like hepatitis B? Because when you're a new mom, you're a little overwhelmed, and there's 72 different vaccines. I mean, why can't we say no? Like Hep B is a great example. A 6-month-old kid is not doing drugs or having sex at that age. Why give them that shot at 6 months old?
Well, hepatitis B is usually given at the day of birth, and I don't think that's necessary. If the mother has hepatitis B or is at risk of having had it, if the mother is a drug addict, for example, then it's good to give the child hepatitis B on the day of birth. But that's very few children, so most children do not need the hepatitis B at birth. And that's an example where the vaccine schedule is not very scientifically sound. We can wait with that vaccine till later.
I like the argument that you're making about vaccines with respect to RFK Jr. I mean, would seem to be arguably be a concern. Maybe that's a feature, not a bug. The idea that if somebody who is a vaccine skeptic, maybe even perceived to be anti-vaccine, at least at some point in his life, if he's going to be the one kicking the tires, and along with Makary at FDA and Bhattacharya at NIH, and yet moving along the research into vaccines and cures for diseases and all the rest of the medical research. A skeptic like him, if he's moving it along, that actually will inspire more confidence because he's not a rubber stamp.
Exactly.
Yeah. So okay. Before we let you go, I had to get to Fauci because I know you're fast friends. Tony Fauci having his whatever security detail he had removed, and Tony Fauci accepting the pardon from President Biden, sort of in the same vein that people who are guilty are always accepting pardons. Well, I'm the subject of a political witch hunt, and so that's why I'm accepting it, even though I've done nothing wrong. How did you react to Biden's preemptive pardon of Fauci?
I find it strange. The one good thing is that he cannot plead the fifth if when he will be under oath to say things about what happened during the pandemic.
That's true. And your friend Jay Bhattacharya, what do you expect from him at NIH, and have you had any communications with him or Makary at FDA about some of the people that were ostracized from the medical community, equally credentialed, equally talented, equally accomplished, or more in many cases, like you and Bhattacharya and Makary and Sunetra Gupta and others, about the sort of the new Jerusalem that is forming in the public health agencies?
Well, I'm very excited about both those nominations for NIH and FDA, and I think it proves that Trump and RFK Jr. is serious about restoring evidence-based medicine and the basic principles of public health to these agencies. They have a long career of always following the evidence, both before the pandemic, but obviously during the pandemic when they bravely spoke up against some of the nonsense that was going on. So that's very encouraging to have them nominated to NIH and FDA positions.
Dr. Martin Kulldorf, former professor of medicine at Harvard and Mass General Brigham, also, I should say, a founding fellow of the Academy for Science and Freedom. Professor Kulldorf, thanks so much for joining us again. Appreciate it.
Thank you.
Thank you. And he joined us on our turnkey.pro answer line.
It's what Chicago is talking about. It's Chicago's Morning Answer with Dan and Amy on AM 560. The Answer.
With over 50 years of precision tooling, that's a lot of job shop work and custom parts. And it's why Bruscher Machining is the go-to CNC turning and machining company in Chicagoland. If you have a custom project, whether it's a single prototype or a short-run production of a few thousand pieces, give them a call today for your free custom quote, 630-876-1661.